Time to talk a little eye on health here. And the cooler weather is kind of sticking around. And health experts say the change in temperature could mean more headaches for you, could even mean migraines for you. I bet you didn't think about that. We've got our medical expert, Dr. Jennifer Moreira from Baylor Scott White. First thing I want to ask you is, because I didn't even think about this, I will say I've noticed it, but why would a change in weather trigger a migraine?
Yeah, definitely. So definitely weather changes can affect the barometric pressure outside. It can also affect, for example, if the weather changes, allergies can flare up as well. And so whenever this happens, we can start having pressure in our sinuses. It can cause chemical imbalances on the brain, like on serotonin, and that can induce migraines as well.
And we know allergies are especially difficult here in Texas, you know, with the weather change, the rain, it can get really bad. What kind of weather changes are we talking about when it comes to migraines? What are we looking for in that area? Yeah,
so a study done in Japan in 2024 demonstrated that the specific weather changes were low barometric pressure, humidity, and rainfall. And rainfall, right, that can bring in pollen if it's in the spring, ragweed, affecting allergies. And so that can induce those migraines, or especially patients who already suffer from migraines, it can increase the frequency of them getting headaches.
Yeah, good to know. This is why you watch First Alert Weather and you know what's going on, right? Okay, what do we do? How do we protect ourselves when that headache is coming on, that migraine? You can kind of feel it with the migraine. Sometimes the headache will pop up out of nowhere, though, and there could be many different reasons. How do we protect ourselves?
Yeah, so when it comes to the weather, it's a little bit hard to predict that. If you know that ragweed or pollen affects you, you can wear a mask if you know you're going to be outside. But you also want to keep an eye on other triggers that you might have. So some people, they have triggers to stress or certain foods. So if you know that that is a trigger, you want to do stress reduction activities.
And I was going to say, that leads me to my next question. You know, there are a lot of ways you can treat, you know, headaches holistically besides medication. Anything you recommend for treating those migraines specifically?
Yeah, so we have two types of classes when it comes to migraine treatment. We have abortive medications, which means stopping the migraine. Usually that includes NSAIDs, so that would be ibuprofen, naproxen. We have triptans, and those are just a few to name in that abortive class. And then we have preventative medicines. Those focus more for patients who consistently suffer from migraines.
Like you said, like chronic stress or something that might be a trigger. All right, good information. Cold weather, headaches, and migraines. I didn't know, and now you do. Thank you so much, Dr. Moreira, for being with us. Baylor Scott White once again. Remember, you can always catch up on our Eye on Health segments on our CBS News Texas YouTube page. We'll be right back.